Hi, everyone, and welcome to this live session, uh, which is part of Collective Learning Certificate 1 Supply Chain for Health. This course is delivered jointly with the Association of Industrial Pharmacists of Nigeria and the IAPHL Nigeria chapter. Now, all of you have been doing great throughout the last couple of weeks. I know most of you are in the final stages of completing the first course in the series. And then very soon, once everyone finishes it, we will begin the next CLC2 course as well. But before that, let's quickly learn more about downstream functions and in there look into outsourcing, which is today's topic. Now, for today's session, we also have our expert facilitator from Nigeria, Mr. Ogbuche Odo, with us. So for today, I will try to speak less and I will ask him to speak more because this is an important topic from the perspective of Nigeria as well, and in general globally, where outsourcing is taking a lot of momentum, especially in the downstream functions of warehousing and transportation. So today we are going to learn one, whether outsourcing is required. Number two, if it is required, then what is the right way to approach it? Um, and then how to monitor it. Then we will look into some case studies as well to help you understand how some countries or some programs have used 3PL or 4PLs in managing their medicine supply chains more efficiently. So that is today's session. However, we are focusing on downstream functions like warehousing or transportation. But outsourcing can also happen in upstream functions. So, for example, in procurement as well, or in freight forwarding, so to say. So those kind of functions can also be outsourced. But for today's specific focus, we are going to be discussing more on in-country transportation or transportation from from your central medical store, central warehouses to regional or service delivery points, where outsourcing can also be used and can be really meaningful, um, for many programs. So very quickly, let me take you to the next slide. Share for some reason it's moving very slow. Um, yeah, okay. So we are on the next slide. Yeah. So, as I said, we will understand the concept of outsourcing and how to approach it. See, the thing is, uh, in a lot of countries, administrators of health supply chains, they have thought about outsourcing, but it is not easy to, give reins of your medical products transportation to someone else. Um, a few weeks ago, I was in a conference, and one of the discussions was, who to give your transportation, so who to outsource. The question was, if your providers, if they don't have better capabilities than yourself, then how can you even, outsource that functions? So this is what we will also study in this session, that in order to outsource certain functions to a provider, 3PL, for example, the 3PL must have better capability and capacity to do that work than yourself. Otherwise, then outsourcing will not really be beneficial for your organization or for better efficiency in supply chain. To discuss all that and take you through the session, I would like to invite Ogbuche in this space. And then, after Ogbuche is finished, then I will also come back and take you through the case study from India. So, Ogbuche, over to you. Excellent.
My mic was off. Thank you, Sanjay. And once again, thank you everyone for the opportunity to partake in this section. So today we'll be looking at basically outsourcing, as Sanjay mentioned. I'm sure this is a word that we are all familiar with. Outsourcing, as the name implies just outsourcing or contracting out some functionalities that you would ordinarily would have performed in-house in your organization. So let's move on to the next slide, where we'll be looking at the introductory aspect of outsourcing. Okay. So I think, okay, you skipped the slide. Okay, so basically in outsourcing, most often you outsource non-core functions. And for a lot of organizations, the most common thing that is outsourced, even in our own local context, has to do with transportation. That's distribution, maybe from the national or regional warehouses down to the last mile distribution. You can also outsource warehousing services as well. So we'll be looking at all the components of the work processes that are outsourced, the risks that are involved. There are some low to medium to high level risk in outsourcing some particular aspects of your operations. And so basically outsourcing, like we talked about earlier, has to do with outsourcing or contracting out non-core processes. These processes are most often less critical, and they are outsourced or contracted out to specialized providers, 3PL, third-party providers that have some level of specialty in carrying out this particular function. Just as Sanjay mentioned earlier, it makes no sense contracting out a role, a functionality that you can do better than the person you are contracting to. Okay. Yeah. Okay. I think it's a bit slow. So we are looking at some categories of outsourcing. We have about 8 of them here. We've mentioned some of these processes while we were talking. There's a process outsourcing where you outsource specific processes within your organization to a service provider that is best suited or has better capacity to carry out such. Outsourcing your accounting processes, human resources. The organizations that do HR just as a specialty. And so when you want to recruit, you can reach out to those kind of organizations to carry out recruitment or human resources functions to you. Sales also part of activities that can be outsourced. So basically, process outsourcing has to do with giving out, contracting out a process that you ordinarily would have done in-house to a third party who is best suited or who has specialty in carrying out such processes. We also have IT outsourcing. This is also very, very common, where you outsource the information technology functions of your organizations to organizations that are specialized in carrying out such functionalities. We also have knowledge process outsourcing, where you outsource high-level knowledge-based tasks, such as research. So the organizations are basically, especially for sales and marketing, they do research and development, market research and all that. So you can outsource, especially if you are planning to move into a new environment, you can outsource to those kind of persons to do the market research and all that for you and give you the information that you need to decide whether you're moving into the market or not. Of outsourcing, where you outsource an operational function to a third party, and this is most commonly used, especially when you outsource your transportation or last mile delivery, as we know in this balance, especially for health commodities, to from the regional warehouse or the national warehouses to the service delivery point. We also have project outsourcing, where you hire services of a provider to complete specific projects to you, especially maybe for a project that you want to conduct a pilot, an activity on a small scale to test the efficacy. Once is able to do it and do it successfully, then with that data, you can also scale up to the activity or the project, so to say. There's also professional outsourcing. This is outsourcing to an expert or specialist to handle a task or project. This is mostly for technical work, technical activities that you need a local specialist or sometimes even an international specialist to carry out for you. There's also manufacturing outsourcing, especially common here in the pharma industry, where you can go abroad, maybe to China or to India, to manufacture a particular product in your name and then bring it into the country for sales and distribution. There's also multi-source outsourcing. Basically, as the name implies, in multi-source outsourcing, they are contracting to more than one service provider. And so the example that I gave earlier on with regards to the transportation. So let me use the GHSC PSM project where a number of us are familiar with. And so they carry out last mile distribution using third-party providers to over 9,000 health facilities, if I'm not mistaken, across the country. And so multi-players are involved here. It's not just a single service provider that carry out this last mile delivery. You have people maybe delegated to specific regions or to states within a region. So there are multi-players involved. And one of the advantages of using this multi-source is that it helps to lower your risk, because when you hand over the 3PL services to a particular or one provider, if anything goes wrong, your risk is higher. But if you have multiple, then the risk can be diluted, so to say. So then, okay. So we'll be looking at advantages of outsourcing. To make it more interactive, maybe in the chat, if you know of any advantages of outsourcing, you can just type it in the chat box for everyone to see. We're looking at advantages of outsourcing. Anyone that has any advantage based on your experience or what you read, you can just indicate it in the chat box as we proceed along. Okay, so we'll be looking at the advantages of outsourcing. You know, Sandy asked a critical question while carrying out the introduction, and he asked if outsourcing is necessary in all circumstances or in all situations. So we'll be looking at the advantages, and then probably from this we can infer when not to outsource. So issues faced by public sector organizations. In our context here, we'll be looking at probably maybe the drug management agencies for us that we have, the local CMS, the central medical stores. So a lot of the issues that come up is lack of in-house expertise or high turnover of employees. In a number of government establishments, people get jobs and move out maybe because of low pay and other issues related to conditions of services, or sometimes the expertise is not there. So in situations like that, you can look for private sector players that have specialized cutting-edge expertise in a particular operation or the particular field where you lack this expertise. For example, technical assistance for warehouse pallet localization, developing the annual plan for training from a capacity assessment. Probably you would have done, you got a consultant to do a capacity assessment and they've identified gaps in the skill sets of the individuals or the workers that you have. So you can outsource the training of these workers to a party that is specialized in carrying out human resource development. So basically, this is one of the advantages of outsourced providers. Another issue that is faced by public sector organizations that would require the need to use outsourcing is limited resources available or temporary need. So there are some needs that are temporary, they're not permanent. And so because you might not just want to go through the hassle of recruiting people to come and do that job, you just want to outsource it to somebody who specializes in carrying out that kind of work, and in turn helps you to save costs. So this allows for expansion of services without investing in infrastructure or staff. For example, developing the activity-based costing function of the warehouse information system, accounting module, etc. So you might already have maybe a warehouse management software, and then you want to optimize it, or you want to enable some functionalities that you probably didn't have before. So instead of getting new staff or even getting another warehouse management software, you can get a consultant, maybe some service providers that can help you to optimize this platform. Limited volume is another issue that public sector organizations face that necessitates the use of a third-party player. So the advantage here is risk mitigation. So a contractor can leverage demands of several clients and consolidate to achieve economics of scales. For example, transportation. So for transportation, let's say maybe you have a less than truckload, and it will be more economically wise to carry out a full truckload. And so if you have a service provider who is into it, they can consolidate the products from different players and eventually have a full truckload that would be cheaper in the long run than when you're just carrying maybe like 5 boxes or 5 packs of a particular consignment to deliver to a place. But the drawback here is that while aggregating the products from the various players, time might be an issue. But when you look at it in terms of cost benefit of the cost it would take to just pick a few quantity to the service delivery point or to the location where you want to take it, as well as waiting for some time to get these products aggregated and transported, you can decide to make the decision whether to go with it or not. So another issue that public sector organizations face is variable demand, in the sense that you don't have fixed demand. The demand is not fixed. So for this month, you can have very small demand. The next month, it can be very high and all that. So it's not something that you plan with. So in instances like that, you can outsource to 3PLs who can work on demand. They can manage both constant and variable demand because they're not just doing your job, they are doing other things as well. And in the process, they'll be able to break even compared to you who don't have like a fixed schedule where you can appropriately plan to break even. Another issue faced by public sector organizations is inefficient service delivery. So improved efficiency is one advantage, is that the 3PLs can also provide. So since 3PLs are private for-profit organizations, the efficiency may yield better service delivery. So we'll be looking at some examples. So what categories of health service are suitable for outsourcing? Maybe I should go back for us to just indicate in the chat. From what we've discussed, what categories of health service do you think are suitable for outsourcing?
Yeah, just to add a quick note here, while we started discussing supply chain, but we also want to make sure that you understand outsourcing as a service. It can be applied across health services. So in this slide, which is going to show you very soon, is to show you that supply chain is just one of those areas within health services where outsourcing can be used. But there are other areas as well. within health services where outsourcing can be used, and that is what the question of which has asked you. Back to you, which.
Thank you, Sanjay. So the chat box is still empty. Is it that nobody's okay? I've seen logistics and transportations, IT functions. Abubakar, that's good. There are numerous things. Okay, training, warehousing.
Think broad, think health services beyond supply chains.
Like Sanjay mentioned, it's not just supply chain. Okay, somebody, Aminat is saying staffing. Yeah, if I can do a thing, just think beyond supply chain because there's so many other activities, processes, and functionalities that can be outsourced in the healthcare setting aside supply chain. Supply chain is just one of them. Some persons have mentioned training and education. Yes. Okay, yeah, security, better, that's good. What about some clinical functions? Is it possible to outsource some clinical functions? Okay, thank you all. So let's just proceed. So some categories that can be outsourced include health information technology, training and education, this was mentioned, supply chain, which entails transportation, warehousing, and distribution. Even freight forwarding can fall under this to data management, epidemiology and surveillance, laboratory services, research and analysis, yeah, public relations and communications, because there are firms that are just into public relations and communications that you can engage to carry out, to handle communication-related activities for you. Someone mentioned this as well, human resource and infrastructure, financial management, and then monitoring and evaluation. So from this overview, you can see that there are so many things that can be outsourced even within the healthcare settings, and it's not just a supply chain. So
Just a quick note
Mm-hmm.
here, which is sorry. Um, just to contextualize some things here. In a lot of countries, and not just Nigeria, I mean, in a lot of low and middle income countries, all these categories that you're seeing on screen, sometimes they are managed by some development partners, on behalf of the government. So, for example, a very good example is surveillance. In a lot of countries, surveillance is managed by World Health Organization. While they may do it in collaboration with some of the government officials, but in many countries, Nigeria would definitely have a dedicated department within the Ministry of Health, but in many countries they don't have. So what happens is that World Health Organization's surveillance teams for various diseases, they support them, and it's also kind of outsourcing as well. I mean, it's not intentional outsourcing, but it's still outsourcing in the form of support. You know, in a lot of countries, financial management can also be outsourced to uh, expert financial advisors, either within, so for example, Ministry of Health's program, but the financials are managed by someone in Ministry of Finance, and even Ministry of Finance have given that to someone else, maybe a private sector vendor, who is expert in financial services. You may have heard a lot of times, big firms like Ernst and Young or Deloitte, they come and do financial auditing, on behalf of the government. And that's also outsourcing. Same with monitoring and evaluation. In Nigeria, so many programs have different monitoring and evaluation components which are outsourced to other organizations or consultants in a lot of cases. So just to say that, uh, you need to understand outsourcing is not only happening in supply chain, but is happening all across. But of course, beyond this point, then we will start to slowly go more deeper into supply chains, and that too into warehousing, transportation. Okay, over to you.
Okay, so thank you, Sanjay. So in the next slide, we'll be looking at the risk level, because while Sanjay was carrying out the introduction, he talked about losing control. And so at an organization as a firm, you want to assess the level of risk for the functionalities or the operational process that you'd want to outsource. So we know that some of these processes that we've outlined have their risk because it's risky in a way, handing out maybe sensitive or critical aspects of your operations to an outsider. And so we're looking at the level of risk, the risk level of activities and processes that can be outsourced by an organization. So the first one is a low level down to the high risk. Activities that are low risk include laundry. These are things that happen in most organizations, especially in the health system. Food and concessions, where you have canteens that are outsourced to maybe food service providers who come to provide lunch and other culinary services to the patient as well as their relatives. We also have coding reviews. That's for data management. We have revenue enhancement services where you get some service providers to help with collection of revenue from the clients and the patient. We also have patient transport, supply chain, including procurement of health products or other products that would be used for aiding the operations of the health establishment. Security, somebody mentioned it as well. Then gardening and ground management, most likely like facility management. So these are like low-level risk activities or processes that can't be outsourced. We also have other support services. The first one are non-clinical services. We have support services that have some level of risk, medium risk, laboratory services, information technology, data analytics, medical facilities management, then training and education services. Then we also have some others, some clinical and support services that have some medium to high level risk, like environmental service, surgery equipment sterilization, not just the surgery process, dialysis, even pharmacy. We have a number of such health facilities in Nigeria that have outsourced pharmacies and their laboratories, even cybersecurity. And then there's the high risk activities or processes that have the highest level of risk, to say, like emergency medicine, cardiology, anesthesia, mental health services. The list goes on, surgery, and other critical care services. The list is not exhaustive, but it's just to give us an idea that there are levels of risk associated with the processes that we outsource, or let me use the word in quotes, try to lose control. Because in outsourcing, you are not totally in control, although you can have some relationship, contract management process that will help you with some key performance indices that you use to measure and then help you put the third-party provider in check. But basically, because of the risk involved in outsourcing, deciding the decision to outsource these processes, you also need to consider the level of risk involved. And if you are willing to part away with losing some control, then after your analysis, then you can decide to go ahead. Next slide. Okay. So in supply chain, outsourcing has become popular due to its potential to solve problems. We looked at the advantages. That also helps to increase efficiency and also bring in cutting-edge expertise that you might not have in-house. Because we said that in outsourcing, most often you are contracting out to a firm that is specialized in carrying out those activities. And with one thing with specialization is that it helps to improve efficiency. Those organizations will probably have better technology, better equipment than what you'd have in-house. So organizations can also outsource different functions of their supply chain, because we know that supply chain entails a lot of parts. So functions like transport and distribution, freight forwarding, custom clearance, warehousing, even incineration of the expired product or medical waste. This can be outsourced as well. For local context, I know for those of us that have probably worked maybe in any of the HIV treatment centers, there are times when there's waste drive where the 3PLs employed or contracted by the GHS PSM project come round to the health facilities to pick expired products. And these products are now taken to a third-party provider somewhere in Port Harcourt Rivers, where the products are incinerated. So that's a typical example of outsourcing the incineration or destruction of medical waste or expiries. Custom clearance is also something that it's outsourced even in our parlance, where the products, once they are shipped into the port, you get a freight forwarder, an expert who will help you out in the clearance of these commodities. Warehousing also, because you have players. I've worked in an organization that was specifically tailored towards warehousing of medical commodities and drugs, as well as consumables, as part of the GHS project. And so you get experts whose expertise entails warehousing, and then you take that load off your head, so to speak, but you have some contract management indicators that should help you to manage these various players that you are engaging. So basically, these are some aspects that organizations can, supply chain aspects that organizations can outsource to enhance their services. So we've seen the diagram here. We just depict an outsourcing life cycle. First of all, you carry out the strategic assessment, look at your risk profile, you look at what you think can be done better than in-house. So you do your needs analysis, and then you look at the various players in the field, you carry out your assessment, looking at various indicators to know if they have the right expertise, if they have the spread, especially if you want to take maybe outsource distribution to somewhere in the Northeast. You won't want to take a supplier or a 3PL that has no base in the Northeast. Maybe a 3PL that is based in Lagos, who is not familiar with the context of what you have in Borno, context of what you have in Adamawa or Bauchi. So those are kind of factors that you need to put into consideration while carrying out your supplier. And then, of course, you need to have some contract management policies in place, some key performance indices that you need to put in place to checkmate or to guard against the supplier going haywire, so to say. So contract management is very, very important. We also look at project initiation, or for that when the provider had commenced the work. And then, of course, relationship management is also very, very essential, because communication and relationship management is essential, because the truth is where you have 2 or 3 persons working together, conflict will always arise. It's a given. And so it's how you manage this relationship that also matters. And then the final stage talks about continuance or exit. So based on your supplier relationship management, your key performance indices, if the supplier is doing well, according to the KPIs that you've outlined from the beginning of the contract, you can decide to continue, or you can decide to exit. Or if you are engaged supplier for a temporary activity, maybe like for recruitment of staff and all that, once that activity is done, you can decide to exit the outsourcing arrangement. So basically, these are just like a key diagrammatic sketch of the processes that outsourcing entails. So now we've just gone through an overview of outsourcing generally, and then tailoring it down to the healthcare environment. So key supply chain functions that can be outsourced. We've mentioned them before. We talked about custom clearance, freight forwarding, procurement, warehousing. You can do it full or partial, transportation, in-country distribution, even to the last mile, facility security, and then information management. So this brings me to a question, knowing all that we've talked about, and then even from your experience, what supply chain functions do you think it's most commonly outsourced in Nigeria? You can write it in the chat box based on your experience.
I think, Shreya, there is a poll, right? Maybe we can launch the poll itself.
Okay, yeah, that would be great.
Shreya? Yeah, excellent. Okay, so there is a poll on your screen. You can choose which supply chain function is most commonly outsourced in Nigeria, and then Ogbuche, you will take us through that discussion.
So the dialog box should have popped up on your screen. So you just answer which supply chain function is most commonly outsourced in Nigeria. Single choice. We have about 5 options there: procurement, warehousing, in-country transportation, sea freight, data collection. So we'll just give like a minute or thereabout to answer and then submit. So are we done? Somebody saying all of the above. The question was specific. Choose one. Okay. So the poll is finished. Majority of us are saying in-country transportation. That's about 88%. So basically, I think this is one of the simplest things to outsource, and this is one thing that is very, very common. I think I tend to agree with us all. In-country transportation from either the long haul from the warehouses to the regional warehouses, as well as from the regional warehouses to the service delivery point across the state, is the most common mode of activities or functionality that is outsourced in country. This is not to say that the other supply chain functions are not outsourced, but I think the majority of us are in agreement that in-country transportation is like the most commonly outsourced function, supply chain functions in the country. So we'll be looking at a case study, learning from the World Food Programme. So the question is, what can the World Food Programme teach us about outsourcing? So the World Food Programme utilizes about 5,000 trucks globally every year. The majority of these trucks are provided by private sector logistics service providers. So they operate 800 of their own vehicles, only in areas where there is no commercial market or where the routes are not commercially viable. You know, for 3PLs, they are private sector organizations, and we know that the goal of every organization is to make profit. And so there are instances of terrains where it doesn't make economic sense to go into, especially a place that have a lot of insecurity. You can't just carry out your vehicle fleet there because of the dangers that are associated, the risks that are associated with going into such places. And we know that for medical supplies, for medical consumables, and then for WHO that deals more with food security, nutrition, maybe the ready-to-use therapeutic foods and all those things that are needed in those kind of places, they'll have to deliver. And so if these 3PLs, the for-profit organizations, are not willing to go, they have to go. And I know that a number of our drug management agencies do that, because I've had calls to work with the Niger State drug management agencies, and they also have their fleet of vehicles where they reach out to, especially in places with difficult terrains, hard to reach areas that the typical commercial 3PL is not willing to go into, or maybe the cost of them going there, it's a lot higher than what you would incur if you are doing it in-house. So these are examples. So the WFP operates about 800 of their own vehicles in areas where there's no commercial market, or the commercial 3PLs are unwilling to go. So using your own in-house freight forwarding capability in a basket of pre-qualified private sector logistics service providers, they manage movement cost effectively and maintain a level of flexibility that allows them to redirect product that is en route to a new destination if circumstances demand it. They have been managing private sector logistics service providers, conducting last mile distribution in challenging circumstances for over 50 years. So contracting is managed by their in-country logistics management team. They conduct biannual RFQs, that's request for quotes, through local newspapers with a focus on cost, provided LSPs can demonstrate their capability to deliver. Charging is closed book per metric ton. Contracts are issued for 6 to 12 months. And that's another thing with outsourcing. You need to give them some reasonable contract length for them to be able to break even. So contracts for WFP in this instance is issued between 6 to 12 months period, with performance assessments at the end of contract and regular KPI reviews. Remember, while we are going through the diagram, we talked about the discontinuation of the exit phase. And so if after the performance review, a particular logistics service provider is not doing as per agreed KPIs, then the decision can be made to either terminate that contract or drop maybe a performance improvement plan for that particular service provider. So contract management and regular KPI reviews is very, very essential. So competition is encouraged, and multiple logistics service providers are often contracted on the same route. While we're looking at the different categories, if you can remember, we talked about sourcing. So WFP have built positive long-standing relationship with the logistics service providers and hold an extensive historical data set on pricing, because this is something that they've been doing over and over. If you recall, it says that WFP have been doing this for over 50 years. So they have considerable data to work with. So we'll be looking at when to consider outsourcing. There are some internal consideration that you need to put into place, as well as external conditions. So let's look at the internal conditions. The first is understanding and affirming the core competency of the central organizations. So remember, we said that most often is the non-core functionalities that are outsourced. So the core competence, that's the core expertise of the organizations. Do they have experts in managing all areas of supply chain? This is what you need to consider, especially when you are looking at your internal organizations. Do you have experts? Do you have the fleet, the equipment, the infrastructure to carry out a particular logistic function effortlessly or efficiently? So you review operational processes to find areas of potential performance gain. The operational processes are also things that you need to look at. Which processes are performing well? Which ones are lagging behind? Can outsourcing improve performance? And if outsourcing can improve performance, how can this be done? Do you have the ability to manage vendor? Because you said relationship management is very, very essential. So do you have like a robust contract management policy or processes in place that will be able to review performance of these vendors, as well as ensure that the vendors or the 3PL providers are working according to the agreed key performance indices? So is there enough funds? Do you have enough employees to manage the relationship with the vendor? What are the key risks? The risk here is very, very important. Remember, we talked about the low level to medium and then to the high risk. So this risk, is this something that you can take? If not, then you need to decide. So technical and political feasibility, key skills about the processes, no governing barriers, no financial barriers. So these are internal considerations that you need to look at. So you evaluate the ability to manage the outsourced vendors. You state and justify if it is technically and politically feasible. So these are internal considerations that you need to consider before outsourcing, before deciding on outsourcing. So we'll go ahead and look at the external conditions that you can consider before deciding to outsource a particular role. So analysis of the existing private sectors. So are there adequate providers in the domestic market? Because it will make no sense going into a market where your in-house capability is better than what you have out there in the field. And so, like the instance of the WFP that we gave from that case study, where they have about 800 vehicles of their own, where they're used in situations, in places where are not commercially viable. So in those instances, probably you do not have cutting edge or specialized logistics service providers in those environments. And so if you do your analysis and then you discover that you don't have viable logistics service 3PL providers in that part or that environment. So let's say maybe using our context in a place that is ravaged by insecurity, banditry, kidnappings, and the rest, where logistics service providers are not willing to go to. Would you want to make do with just anybody there? Anybody that you know that you have better capabilities than with regards to transportation, with regards to warehousing and all that. So these are external conditions that you need to look into. Now, will there be enough competition for good price quality? So one key benefit of outsourcing is competition, encouraging competition. So like the JHSC PSM project, what they do from time to time, they throw open the bid for players in the field to come up. And you know, when you have multiple players, it encourages competition than when it's a monopoly. So if it's just a single player, they can decide to come up maybe after like 3 months and tell you that situations have changed. I want to increase my price. It's priced by, let's say, 100%. And since it's the only one, sometimes you'll be forced to go ahead with this price. But if you have multiple players, and if he decides that he wants to increase his price by 100%, then you have somebody who has similar capabilities and is willing to do it for, say, maybe 20% higher than what was being done before in light of maybe economic indices. Then, of course, you look at that. And if that particular player sees that there are other players there who are willing to do it cheaper, he or she, that particular provider will also be forced to lower their price. So competition is very, very essential. So if you have multiple players, is another consideration that you need to look at. But if it's just a single player or just maybe 1 or 2 persons, you know that the risk is higher. And then can the provider cover all the required range? That's the geography. Let's say you want to carry out last mile distribution to the south. Do you have a provider that can cover all the 6 states, or do you have providers that can cover all the 6 states within the region? So in doing this analysis, you look at the cost-benefit analysis. You also look at the total cost of ownership related to outsourcing. Is it less than insourcing? Will the outsourcing operations lead to improving in service delivery? So if they have better equipment, better processes, better technology than what you have in-house, fine. But if not, the key question to ask is, will outsourcing this operation lead to improving in-service delivery? Are there new externalities? And so sometimes when you outsource, it's even a way of growing your in-house capabilities. And so you could go into an agreement where maybe you outsource for a given period. And then if your in-house capabilities have been improved, and then you can do away with the outsourcing. So those are considerations that you need to put in place. So process maturity of existing companies. How mature are the providers' processes? Can they follow good practices, for instance, good distribution practices, etc.? Can they manage within the required lead times and volumes? So those are KPIs that you decide. If you want to carry out maybe your last mile distribution for maybe HIV, malaria, family planning products, and you have a given time frame, let's say 1 week, can these service providers deliver within that time? Those are considerations that you need to put in place as well.
Yep. Vijay, before you move forward very quickly, let me also give an example here. So, while I was supporting the Ethiopian pharmaceutical supply services, of course, in Ethiopia, so we were supporting them in understanding if they can outsource some of their regional warehouse to, hospital transportation providers. So then we conducted this, process maturity of private sector transport providers. And unfortunately, the process maturity of those private sector providers were at least 30 to 40% less than the Ethiopian pharmaceutical supply services, or ad hoc. For example, if the regional warehouses would just contract out ad hoc, vehicles, and then do everything, most of it by themselves. So the question was very difficult to answer, that okay, if Ethiopian pharmaceutical supply services sitting at a national level would give this contract out to two three different providers, would they be able to do a better job than what is happening today? And the answer was no, because they themselves did not have, for example, one, they did not have proper cold chain equipment. They did not have trained people who could manage, loading, unloading of medical products. They did not have processes to, prevent theft or, damaging of goods during transport, because some road conditions were not really good. Or for that matter, the cost was very high. So if all that was not in the favor of those private sector providers, then again the question comes back to the government agencies, that why should you go and outsource? But then there's one more question. If transportation is not your core competency and you are forced to do it, and the private sector providers are not up to the mark, then what is the alternative? And we still need to reflect on that. So while you reflect on this, Abucha, please, you can carry on. Thank you.
Okay, thank you, Sanjay. For the next slide, we'll be looking at managing outsourcing. So, like I mentioned, managing expectation is very, very important, especially at the beginning of the contract. And that is why the RFPs, the request for proposal, is very, very important. In it, you specify what you need. You specify what your expectations are as a buyer of the service. So as someone who wants to, that's the firm that wants to outsource this particular functionality. So all these have to be detailed in your RFP, as well as the contract that you enter into with the provider. So you need to agree on a detailed key performance indices and service level. So do you want to have a 99% service level, ensuring that at all points in time, the products are available like 99% of the time. You don't want to have issues of out of stock, especially if you are outsourcing maybe your warehousing services. Would you want a situation where the KPI that you've envisioned is that at each time that the transporter or that the 3PL provider moves the products to the health facilities, there should be 99.9% delivery, successful delivery rate, in the sense that you don't even want to have instances, or if at all you have maybe like 0.1% of the instances where you have goods lost in transit and all that. So you need to agree on these KPIs right from the onset, because it helps with relationship management. If these KPIs have not been agreed on from the beginning, then there will be issues later on when maybe the KPIs are not met or when you're having issues with managing these 3PLs. So you also need to monitor the KPIs. From the review that we looked at, especially for that of WFP, we saw that they had regular review of KPIs. So also, it's very, very important that you have regular meetings with your suppliers on performance review to look at the KPIs. Let's say, if you can do it quarterly. I know I've worked in organizations where the KPI review process is done quarterly, where you work with all your suppliers, and then you look at the KPIs across the various spectrum to see if they are meeting expectations. Of course, the KPIs will have the minimum allowable level, and if the minimum allowable level is not being met, what would you need to do to improve that performance? And if it's something that is not being met on a prolonged basis, would you want to get into a situation where you want to terminate that contract or get another person? So those are considerations that you need to do to make, especially when you are managing your 3PL providers. So in all, transparency and communication or visibility is key in managing a service provider. So we're going to be looking at another example, this time around from Uganda. So in this case study, it's service providers that are providing last mile delivery. And last mile delivery to health facilities is operated by private transporters. How is this done? A pilot project was conducted to understand the benefits and challenges from the three standpoints. That's the payer, the service provider, and then the beneficiary. Transportation from the central warehouse to district depots performed by the central fleet, while transportation from district depots to health facilities is contracted out. So the long haul, so to say, from the central warehouse to the district depot is done by the government or the central fleet. And then transportation from the district depots to the health facilities is contracted out to 3PL providers. A multimodal solution was adopted with two private transporters. So in this instance, it was not just handed over to one 3PL provider, but two private transporters. Transporters were selected, given 1-year contracts after a rigorous procurement process and detailed background checks to assess capability. Sanjay is asking a question here. Does anybody know what multimodal is? You can just indicate in the chat box. A multimodal transport approach. You can infer it from the name, multi-mode. Feel free to indicate in the chat box. The chat box is quiet. So a multimodal transport involves just, okay. As you can tell, it's in different types of transports. Okay, let's give an example like bicycle, bikes. So multimodal can entail the use of, let's say, rail, road, that's using a truck. So in the context of the last mile delivery, there are instances maybe we can use trucks, and maybe in riverine areas where trucks cannot pass, you can use boats. You can also use motorbikes. So those are multimodal, as in using different modes of transport. So a multimodal solution was adopted with two private transporters. Transporters were selected, given 1-year contracts after a rigorous procurement process and detailed background checks to assess capacity. Remember, we talked about assessing the capacity of this particular provider because it would make no sense giving the contract out to an organization where you have better capacity than. So 5 business days is the service level for transporters to reach the facilities. So this is another key KPI that they agreed on, ensuring that from the pickup from the depot, the transporter has 5 days to deliver this product. So anything beyond that 5 days shows that they are not keeping with this particular key performance indices. So the accuracy and timeliness of product delivery has improved significantly. So from this example, the question now is, what do you think? Is outsourcing cheaper?
Now, this is where you can speak as well. Anyone who would want to comment on this question, I mean, we can have a small discussion here from different contexts. The question is outsourcing cheaper? So anyone who has any experience or anyone who would like to comment on this?
So the section is supposed to be interactive. So if you have any experience, you can just signify, and then we'll let you speak. If not, we'll proceed.
Yes, Farm Hafsat, please, you can speak.
Yeah, good evening.
Good evening.
Yeah. Outsourcing can be cheap in some instances and expensive in some, actually. The same way we talked about if it's going to be if it's going to add more value to your place, you have to weigh it. So if while like checking maybe the performance indices, what is going to happen if you spend from outsourcing. For example, the way you said, let's use if you have just 5 cartons of products you are going to transport. So instead of you to use your own, you can just outsource with, from other people that are transporting the larger products so that you can transport it, which will be cheaper. So in that aspect, it will be cheap. But in some aspects, it can be expensive too. Yeah. That's my own take.
Okay. And anyone else who would like to comment here or, provide different argument? Yes, Aliu Abubakar, please.
I think it depends on the context, but generally nowadays, I would say it is cheaper because branding is important nowadays. There are many common functions that you can find everywhere. There are companies that are dedicated to doing that. So in doing that, a company can focus on its core functions and core activities, leaving that to the outsourced company. I think generally it is cheaper. It offers more advantage. But also that depends on the procurement process. You should have a rigorous procurement process to have value for money.
Okay, that's good. Josephine, would you like to say something as well?
Okay.
Yeah, Josephine, you had unmuted yourself. Do you want to speak? Okay, anyways, there's some points on chat. Ume is saying the cost is relative, the technical requirements for carrying out the task, I think something is missing then. Isaac is saying depending on what is to be achieved. Yes, if there is value for money. Indeed. So as as Oguche, sorry, there is more from Ume. There is available in-house, then it becomes expensive to outsource, but if not available, then cost of outsourcing is justified. Yeah, okay, that's excellent. Now, the reason why we're asking this question is because there are a lot of instances when, and I don't want to use this term, but let's just say a lot of instances where, um, you know, I would say, malpractice or poor business practices, some people would want to go for outsourcing because the provider has some sort of familial connection, and it happens in a lot of countries. Now, the justification that is always given is that, that is cheap, that outsourcing is cheap. But it's not the case. Outsourcing may be really, really expensive if not conducted out properly, you know. So, yes, the objective of going for outsourcing is always to find one, better service delivery and lower cost, because the providers are doing it in higher volumes than yourselves. So they would be able to provide you better prices than if you buy a fleet of vehicles. Because if you buy a fleet of vehicles, then you have to either get people out on contract as drivers or recruit them as well. Then you'll have to buy fuel. Then you will have to invest in maintenance and services of vehicles. Then you have to make sure you keep enough money for breakdowns, for theft, for this and that. And that is a lot of money that you have to invest in just to make sure your own fleet is operational. When you outsource, you don't have to worry about all these things. You don't have to worry about recruitment of drivers. You don't have to worry about fuel. You don't have to worry about theft or pilferage or whatever. All that is part of the single cost. The costs are either by volume or sometimes by volume plus distance. So very simple costing. Outsourcing for transportation has a very simple costing. Okay, and the provider is giving that cost after doing all the calculations of managing their own fleet. But because they're not doing it only for you, that's why the costs are relatively low. But if that is not the case, then outsourcing should not be done, and should never be done because someone's nephew or someone's uncle works in a certain organization, and hence that organization needs to be involved in the process. And we have seen that happening far too many times in our own countries, and that is not correct, and that is not right. So, like Oguche took you through the session, if you are considering for outsourcing, there are two sets of conditions that you need to first look at: internal conditions and external conditions. And then you need to decide whether outsourcing is necessary for your organization and the function that you want to outsource for. I think this was the end of the slides, right? No, okay, there were some challenges. Okay, so I will give it back to you, Much.
Okay, so we've seen outsourcing, we've seen the benefits that are associated with outsourcing. So in this next slides, we'll be looking at the challenges that are related to outsourcing. We're seeing that even though outsourcing have been seen to reduce costs, improve efficiency, there are certain risks, especially when you're outsourcing supply chain, that comes with it. And we'll just be going over a few of them here. The first one is the sense of loss of control, because it's like you're handing over this particular operation, this particular process to an outsider, so to say. So those are challenges that are related to outsourcing. Communication problems with the service provider is also a very, very big problem, because managing relationship is essential to ensure that the objectives of the contract are met. And that is why it's essential to begin from the very beginning, manage the expectations, let them know what you want. And if they're able to deliver, they should be able to tell you. And so communication and transparency is very, very important. This is one key area that challenges often emanate from in managing 3PLs. Another thing is unforeseen and hidden costs. Sometimes you might start the contract and then some situations might come up that were not envisaged from the beginning that would help make the costs to blow. Maybe while you conducted the RFP, you initiated the contract and everything, instances, let's say some economic indices were different then. Maybe like for us now, the removal of subsidy that made everything to snowball. So those are part of costs that might come up. Also, even from the organization that you are contracting, they might have some hidden costs, like maybe admin fees and others that we are not disclosed right from the very beginning. So those are some examples of challenges that might come when you are outsourcing. There's also the security and confidentiality risks, especially when it has to do with managing sensitive data, critical information relating to your organization. The third party in these days of business espionage, the third party might get this information and sell it even to your competitor in the field. This is the risk also. There's also the quality control issues, especially maybe with transportation. You want to transport drugs and other medical consumables that needs to be transported maybe in controlled environment, or maybe using the instances of cold chain. If these particular service providers do not have cold chain transport capabilities, and then the vaccines or the cold chain products are denatured by the time they get to the service delivery point, that's a quality issue. So those are things that you also need to put into consideration. Those are challenges that comes with the job. Service providers' failure to deliver or issues like delays, mistakes in orders, etc. are also challenges that come with it. But when you have adequate KPIs and regular reviews, it will help to mitigate some of these challenges that comes with outsourcing. We also have integration difficulties, especially maybe when you have different equipment, different IT platforms. For example, let me give a typical example, like for the warehousing of the public health commodities in Nigeria. The platform that the 4PL, that's Chemonics, was using was a bit different from what the warehouse providers were using, because with the platform, the order from the 4PL is supposed to synchronize into the WMS of the various warehouses. And so if you have integration difficulties in integrating the platform of the warehouse providers with that of the 4PL, who is sending the order to the warehouse, there will always be an issue. And so while they were trying to set up, there was a pilot process where this was done in pilot before it was done at scale. So integration, especially of IT platform, is always an issue, or it's another area of concern when it comes to outsourcing 3PL services. And then, of course, lack of experience managing providers and staff. So you need to have persons within your employ that are equipped or skilled enough to manage the contract. We talked about regular reviews of the KPIs, regular review of the performance. So you need somebody who is knowledgeable enough, who is skilled enough to be able to handle the management of these 3PLs. So we'll be looking at another case study from Mozambique. This case study deals more with issues that arise from outsourcing 3PL services. So CMS, that's Central Medical Stores, we often state that an outsourced logistics service provider costs more than operating an in-house fleet, while the service level is poor. The definition of service level isn't always clear. And what they really mean is that the transport wasn't at their beck and call. An outsourced logistics service provider will say that their most competitive rate is dependent on good vehicle utilization. Fast-moving consumer goods clients prescribe specific collection and delivery times, which they adhere to, but CMS can make vehicles wait for an entire day. I've witnessed this firsthand. So in the normal commercial vehicle processes, efficiency is what they deal with. But when you come to the government processes, maybe for the CMS, the contract says that bring your vehicle, let's say by 8 o'clock for pickup. The transporter would have brought that vehicle by 8 a.m. and the pick and pack wouldn't have been ready. And so that contract 3PL service provider would be waiting with the vehicle, let's say for like 6 hours. That 6 hours is time that should have been used to do something else. That's an economic time that have been lost. When you look at all this, we discover that from the angle of the CMS providers and the angle of the logistics service providers, the expectations that are not met. So a CMS, we say they need flexibility from transporters because pick pack is manual and they cannot avoid delays. So critics will always say private transport is more expensive and private sector logistics service providers are getting rich. So successful execution of an efficient service is dependent on discipline at the central medical stores to load in pre-agreed collection slot. So if we had agreed that I should bring my vehicle by 8 a.m., that the product will be ready for pickup, then ensure you have that discipline to ensure that those products are available by that time for the logistics service providers to pick. So it is essential for organizations to set an effective risk management strategy to mitigate potential risks with outsourcing. This comprehensive approach includes identifying and assessing risk. We talked about that. We also need to develop a contingency plan. That's more like a plan B, should in case things go wrong. So while monitoring and controlling the service provider to ensure that the outsourced supply chain function operates effectively and efficiently, we'll be looking at some of the risks. A good example of a contingency plan is going back again to our distribution of public health commodities in Nigeria. So the 4PL most often will have a preferred bidder for a particular route and then an alternate bidder. What that means is that when the preferred bidder decides to say, okay, I'm not doing this again, maybe because the situations have changed, then they'll fall back on the alternate bidder. Because if you're just relying on that preferred bidder and then something happens and he's not able to go ahead with the plan, that means the risk will be higher, you'll be at a loss. But if you have an alternate whose rate may probably be higher than that of the preferred bidder, but because the preferred bidder has decided not to do that job at that particular time, you can fall back on the alternate bidder as part of a contingency plan to ensure that the service is not disrupted. So some of the risk management strategies, remember we looked at the risk earlier. So we're going to be looking at the mitigation strategies for this risk. So if you're afraid of losing control, it is recommended to have a well thought out plan that clearly defines the responsibilities to be handed over to the service provider. So project management measures such as setting timelines for meetings, tracking key performance indices, and identifying the person of contact can also help in maintaining control over the process. Communication problem. This is another very key challenge that emanates from contracting 3PL services. It is important to set core business hours, use effective project management tools, and establish standardized formats for communication. So proper information sharing channels can also help in bridging the communication gap. And so back to the WFP scenario where, the Mozambique instance where they talked about, Ugandan instance where they talked about giving a specific timeline of 5 days for the logistics service providers to pick up products from the district depot and take to the service delivery point. So if you want to have good communication to ensure that you're always in touch with what is happening, the logistics service providers should be mandated to give daily updates as to the status of delivery, as to the status of pickup, as well as the last mile delivery, the completion rate that has happened. Because most often it's done in a milk run manner, such that the logistics service provider will pick maybe products for, let's say, 20 health facilities from the regional warehouse or the district depot. So the onus lies on the service providers now to provide daily updates as to the number of health facilities that have been supplied in day 1, day 2, down to the last day. So in that instance, if they are envisaging that they probably will not meet that 5 days. You who is managing the service provider would have known beforehand and maybe prepared an alternate plan or a contingency plan to help to mitigate this risk. So communication is very, very important. Unforeseen or hidden costs. It can be minimized by clearly defining the project requirements and controlling every detail and cost estimate provided by the service provider. Employee productivity management tools can also be used to accurately track work hours and generate payrolls. So you need to put in place program management tools here to ensure that unforeseen or hidden costs are properly managed. And then, of course, there's also security and confidentiality risk. It can be addressed by drawing up an airtight outsourcing contract or service level agreements with the help of a lawyer, and then asking the parties to enter a non-disclosure agreement. So if you are afraid or the likelihood of the service provider leaking your trade secrets to a competitor, then you need to have like a non-disclosure agreement in place, where if he or she or the firm does that, you could be able to sue them. Other risks that we looked at, including quality control issues. You need to have detailed service specification. So you provide service specification, you prepare them for the service providers, and then independent quality control inspections can be requested. So for instance, requesting raw material samples on a regular basis can also help in monitoring that the quality of the final product has been maintained. So this is when maybe you are outsourcing the manufacture of a particular product. You need to ensure that the quality is what you expect. So your expectation, and then you can, like this instance now, get independent quality inspectors to go into the plant to carry out analysis of the raw materials to ensure that the finished product that you are expecting is what the API, if it's a drug, states. Vendor failure to deliver. In case of service providers' total or partial failure, it is recommended to have constant check-ins with the service providers, early alerts, and to draw up a contingency plan, e.g. surplus inventory, to deal with any supply chain challenges. And so there are instances where the vendor will fail to deliver. In such instances, you need to have a contingency plan. Either you have surplus inventory nearby, or you have another vendor, an alternate vendor that can be quickly deployed to help to mitigate the risk arising from the non-delivery of the preferred vendor. Integration difficulties. While operations with the service provider should ideally run smoothly, once fully integrated, the challenge lies on the transition process. This process typically demands a significant financial investment and time commitment from both parties. A transition team with mixed expertise might help. So especially when you have IT platforms that are different, and while you are trying to integrate your processes, there needs to be a transition team. Probably, it might not just transition fully, you might need to carry out a pilot on a small scale, look at all the challenges, fix them before scaling up on a larger scale. The lack of experience with remote teams. These days, remote work is the in thing, especially when you're managing service providers across different regions. You could be in Abuja managing a service provider in Lagos, in Akwa Ibom, Cross River, across the length and breadth of Nigeria. And so it can be, you can overcome the challenges by choosing service providers with a well-established setup for remote teamwork integration. So these are some strategies that you need to put in place to help to resolve these challenges that comes with outsourcing, especially transportation of medical supplies and consumables to treat payer providers. So we'll be moving over to a case study from India where Sanjay would continue from. But in the meantime, if you have any input, comments, or questions, you can either put it in the chat box or raise your hand before I hand over to Sanjay.
Yeah, thanks, Abuja. Please, if you have any questions or comments, you can raise your hands or you can put it in the chat. Shreya, in the meantime, can you show the case study? Yeah, if we can show the case study on screen. Employee redundancy and ease of skills. Aliyo, maybe you may want to speak. I'm sorry, did not understand what you said. Loss of skills. Yeah, of course.
So, would you want to expatiate?
Yes, like when you are outsourcing a function, you have certain employees tend to where like IT, you are managing your IT, you later try to outsource it. Those your employees, you have to get rid of them or find another function for them. And the work that they are not frequently doing, they may be coming dull and they will not be updated on those current trends regarding those functions, leading to loss of skills in that organization.
Yeah,
Yes.
that is, sorry, Abuja.
Okay, yeah. Okay. I was just saying that that's a nice point there because redundancy can set in when if you decide to move a particular process or a function to a 3PL provider. Those staff who were doing it before, although you can get some of them to help manage that contract, but a lot of them will become redundant. And if you don't have any other thing doing with them, most often you will need to let them go. So those are some challenges, especially with HR, that comes with outsourcing. So Sanjay.
Yes, now that's a valid point. However, if we look into very specifically into our health services and health supply chains, uh, this is less prevalent, I would say, in this case, in health supply chain, because first of all, in most places, there are less staff member. I mean, even in Nigeria, I know for a fact that if in a DMA you need 20 people, there are probably 10. If somewhere you need 50, there are probably 30. So you already have less people, you know. So there is always more work for your staff to do, even if some of the functions are outsourced. That is a very peculiar issue in our case. But Ali, otherwise you're correct. In many instances, when an organization decides to outsource some of its functions, the staff who were earlier managing those functions, some of them would definitely become redundant because they don't have to now execute that particular function. Now, either those staff will have to be reallocated depending on their skills, or they would have to be laid off. But that is something, I mean, which is in a bigger scheme of things. It is okay because many of those staff members, they would eventually go and work in those private sector companies as well. So uh, from the perspective of health services, we generally always talk about a larger labor market ecosystem where if you have certain skills, then you should be eligible to work in the public sector or the private sector, you know, depending on your skills. But yes, you're correct. Outsourcing also comes with a very uh, big disadvantage for human resources when they become redundant because certain functions have been outsourced. Is there any other question for Oguche or any other comment on the session that has happened so far? Okay, that's fine. If in the meantime you get any comments or questions, please you can raise your hands or you can also write them in the chat. Uh, The end of today's session will be with this case study from India. Now, let me give you a bit of a context first. When it comes to the HIV/AIDS program, India's HIV/AIDS program is one of the largest in terms of number of patients, in terms of number of antiretroviral medicines, test kits, and everything else that needs to be transported from one place to the other. Since India is a very large country as well, also it's very difficult because a lot of patients are in you know places with difficult terrains. So, for example, some are in desert areas, some are in very mountain locations, or some people are in very deep forest who are either HIV positive or need assistance in through the program. So, uh, logistics of HIV/AIDS commodities was a big challenge. And this particular project, which was executed by Plan International Plan India, with the funding of the Global Fund and, of course, working with the National AIDS Control Organization of India. So this project started somewhere in 2019, and the objective was to fix the last mile transportation solutions in the country. Now, in general, the way it was working was that the National AIDS Control Organization, which is based out of the capital of India, Delhi, they used to procure all the medicines through the manufacturers who are also located in India. And then those manufacturers would directly transport the products to the states. So at every state, there is a body called AIDS Control Society. So the manufacturers would directly distribute the products to the states, and then it would be the responsibility of the state to transport those products to the antiretroviral therapy centers, ART centers, or the diagnostic centers. Sometimes the centers were same where diagnosis and treatment was happening, but sometimes there would be different centers. So ART center would be separate and the diagnosis center would be separate. So it was a massive challenge when it came to last mile distribution. So from the state level going to the diagnosis or the ART centers. And that's where the biggest gap was. So if Shreya, if you scroll down to the next page. Shreya. Yeah, if you can scroll down to the next page. Yeah, thank you. Yes. So as you see here, so I believe this document is also with you. So the objective of this project was to, of course, improve the operations, was also to provide technical assistance to the central system of National AIDS Control Organization and also to the state AIDS societies. Was also to strengthen the ELMIS system. So there is an ELMIS system specifically for the HIV commodities. Now I know you may say that okay, this does not look like an integrated system, which is not. So HIV/AIDS in India is the only program which is not integrated into the larger system. It still runs a parallel system because of its own scale and complexity and how it was established 20 years ago. So because of certain legal and administrative issues, it has still remained a parallel program. Anyhow, they have their own ELMIS system, and the project also wanted to build capacity of the state and national level staff. However, what we will focus on is the operations. Shreya, if you can scroll down again, slightly a bit more. So so just in this part, this part. So if you see here, there is a graphic which says procurement agent, then it says warehouse, CMSS warehouse, which is a central and regional warehouse. Then there is a state level warehouse. Then there is the ART center where the treatment happens, and then the patient. So this is the normal flow of products for the AIDS program in India, HIV/AIDS program in India, where the procurement agent, which is with the National AIDS Control Organization, would procure the products. First, it will go to a regional warehouse or a national warehouse in some cases, but mostly regional warehouse. And then from regional warehouse, after consolidation, it will be sent to the state warehouses. In a lot of cases, the products may directly go to the state warehouses as well. From the state warehouses to the direct to the center and then to the patient. Now, the intervention that they created at this in this was to have a 3PL, 3PL provider from taking the products from the CMSS warehouse to the state warehouse and from the state warehouse to the ART centers. So that's where they had this outsourcing intervention. So you can read this, in details, but I will give you the, high level points. So if you see in the success stories now, share, if you scroll down to the success stories, so they were able to achieve 95% on-time delivery rate and 99% delivered in full. Okay, so these are some of the transportation indicators. Here, if you can scroll down, share. I think there's a bit of a lag between my voice that is reaching Shreya. But anyways, yeah. So if you can scroll down, yeah, yeah, that's it. That's fine. Yeah, that's fine. A bit up, slightly up. Shreya, slightly up. Yeah, that's it. Yeah, stay here. Yeah, so you can read the detailed case study by yourself. But if you see the graphic here, the before and after graphic, you would see that there was a long approval process, then intimation to transporters, then delivery time, and overall timelines. So if you see the overall reduction that is there. So the approval process came down from 15 days to 1 day because now they're using ELMI system to the point of transportation as well. Then reduction in the number of days of intimating the transporter of on what to do. The delivery time came down from 35 days to 11 days, and overall timeline came down from 8 days to 13 days. 13 central level, then as well. So that is the they could achieve in a country like India. So you can see India is a very large country. There are 29 states. So what they did was they divided these states into certain regions. And then based on those regions, I think there were initially 2 transporters and later on 3 transporters. So each transporter had a region. Okay. So working with the NACO, which is the national body, working with CMSS, which is the central and regional procurer and warehousing agency in India, they were coordinating all of it through an ELMIS system, and the transporter would pick it up from the CMSS warehouse regionally and either send it to the state warehouse, or many times the they would pick it from the state warehouse and then send it to the ART center, and all that was had become really streamlined. So this project shows that it does not matter how big country is, how challenging the terrains are. If a project is designed, an outsourcing project is designed properly with the right providers, with the right kind of KPIs in mind, with the right kind of costs associated with it, they can succeed. And that's why we are showing you here that outsourcing of large, complex distribution projects can also be successful. Okay, so now if you now compare this with your country in Nigeria, for example, there can be outsourcing at a federal level, there can be outsourcing at a state level, and from state going down to your local government areas as well. But there are some key things that you have to look into, that the providers are really good. They have they can cover the full geographical scope for each and every state that they're involved in. For example, in India, like I said, some states they have deserts, some states they have very thick forests, some states have mountain roads and mountain conditions, and then there are some states which are swampy, so the providers were chosen regionally because of this, because they could cover that entire region, depending on the terrain, depending on the environmental factor, depending on the geographical factor, all those things. So if you keep in mind those issues while choosing a provider, and that after rigorous procurement processes and looking into your cost benefit analysis and efficiencies and delivery timelines and everything, then it is inevitable that you will be able to achieve better efficiency in your supply chains with a third party provider. So that's why we wanted to show you this India case study, because in 2 years, 2 to 3 years time, so it started in 2019, and by 2021 and 2022, they were able to show massive uh, you know changes in the supply chain indicators in India for the HIV program, for the HIV/AIDS program. And today, I believe uh, this transport network is now being used for other programs as well. I think malaria is also piggybacking into this, because it's all through the global funding. So I think malaria and tuberculosis are also piggybacking onto some of these systems at some of the state levels. Okay, so this is just to show that large scale third party logistics operations can also be managed. Yes, it can be really complicated. Supply chains can be complicated depending on the context, depending on the size of the operation, but it doesn't mean that you cannot succeed. So in a country like Nigeria, which is also pretty large, similar to India, many states, different conditions, a very mixed administrative structure where there are some programs managed federally, essential medicines program run state at a state level, every state having their DMAs with different LMCUs, then local government areas. So with all this, even with all this, your outsourcing operations can succeed if you do them, if you manage them properly. Okay. So this is what I wanted to show you from India, a very positive and reinforcing case study towards outsourcing. Now, of course, like we said, Ogbuche said, you have to be very careful while designing your outsourcing operations. You have to take into account all those issues which we discussed. But if we look, globally, if we look today, the trend today is to go for outsourcing for those functions which are not your core competency. Okay. So functions like our transportation, warehousing, they are definitely the ones they would be outsourced in the next 5 years, even in Nigeria, most likely. Okay. So you as supply chain professionals must be ready to manage those outsourced providers. And this session was aimed at giving you those points on how do you manage them. Okay. First, how do you select them and how do you manage them? So I will invite Ogbuchi again on screen. And if you have any questions, any clarifications, any comments, this is the time. We still have 5-10 minutes that we can answer your questions and comments.
Okay.
Any
So,
questions, any comments?
or does anyone want to share any personal experience that you have? Maybe if you've been involved in outsourcing a particular process or job role to a third party. Any personal experience, feel free to share.
Okay.
Okay, maybe I call him. Aliu, I know people do a lot of outsourcing in Yobe State. Can you just share experience that you had maybe managing 3PLs? It might not necessarily be you, but your organization as a whole.
Oh, well, I think we haven't reached a conclusion on that it has kick-started, but because we are using different softwares. We have our Yodma IMT, and for that one box, I think they are the one that we contracted for the TPL. And up to now, they are working on it. I think the technical team on merging the softwares, how they can have data a kind of synchronization of the data to facilitate sharing of information regarding the items, what to pick to take to another place. But it's not my area much. I'm not much into it. Right now I cannot tell you the full status of the progress towards that TPL. But the only what other service? I think it was our IT service, the inventory tool we are using. Formerly we were using M Supply, and so but later we switched to develop our own because of we have seen the cost, and there are some functions that it's not really suited for our activities here. We decided to switch to our local IM to do in-house. So we developed our inventory tool in-house and stopped using M Supply.
Okay, so you went from outsourced to insourcing.
Yes, we
Okay,
brought
now
back the
that's also a good experience, because sometimes some of the features or functions and specifically in IT that you're looking for may not be there from an outsourced provider, and hence you may have to invest a bit in insourcing so that for a longer period of time you may save on those costs that you give to your outsourced provider. Yeah. Okay, that's good. Very quickly, Shreya, do you have any basic snapshot of the progress up to today? Um, do we know if there is someone who is really lagging behind and then we need to support them a bit more? Shreya, I think it's a bit slow going from my side to hers. Shreya, can you hear me? Okay. Seems something is a problem, but anyways, I just wanted to say that if you are lagging behind, please reach out to us. Yashria, are you there? Can you comment on if we know who's lagging behind?
Yeah, Sanjay. I'll just I'll update you just a second.
Okay, no problem. So when you're ready, you can start to speak. But
Yeah.
I just wanted to say that if you are anyone who is here who's lagging behind, please do not hesitate to reach out to us, to Shreya, and we have a new community coordinator called Muskan, or myself on WhatsApp or on email. Our objective is that by 26th of August, which is in about 2 weeks' time, everyone should have completed CLC 1, so that we take a break of about 7 to 10 days, and then we begin CLC2 with all of you who have enrolled in both of them. And if you are here only for CLC1, then that's great. You should have finished it, and you will receive your certificates. But anyone who's behind, please don't worry. You still have a lot of time. All the recordings of the sessions are available to you. You can review them. You can still reach out to anyone from the group or ourselves through WhatsApp, through email, and we should be able to help you, as soon as possible. I think at this point there is no one who's facing any IT challenges, because sometimes in the beginning that happens. But as we move along, you know now how to navigate and how to move forward. So this was the last technical session. We will meet again once CLC1 comes to an end. We will try to do a certification ceremony and a community event, and then CLC2 will begin, where there will be more sessions, technical sessions, for you to participate in. Shreya, if you have the data ready, that's you can speak. Otherwise, I mean, we can anyways share it on WhatsApp and keep the communication there. Okay, she's showing the screen. Yeah, so excellent. So most of you are, I think for Alius, I think we have to check it again because I think we discussed, uh, or maybe not, I don't know. But Aliu, Chidima, Mariam, Hafsat, Blessing, and Ume. You're until Ume, I think you have to speed up a bit. Will be left behind. Everyone else, I mean, people who are in the 67% or 83%, I mean, you're far ahead. So you should be able to easily complete your course in the next 2 weeks. But people who are a bit behind, the first 4 or 5 names, you should speed it up. If this might be slightly old as well, we are not sure. I'm not sure if this is from today or from this earlier from this week. But even if you are at 20-25 percentages for progress, please you need to speed it up a bit so that you can complete this by around 26th of August. Okay. If you face any problems, please reach out to us and we will be able to resolve any issues that you may face. Okay. If there is nothing else, I would like to again thank Ogbuche for today's session, leading today's session and sharing a lot of the insights from his own personal experiences. And I would like to thank all of you for joining us again on a Saturday. Next weekend there is a community event which I will invite you all. It is not a technical session, but that is more for all the participants to, communicate more and have more peer-to-peer interaction. Shreya and Muskan will share the details and will send the invitations and everything to you. So please participate in those in the community event as well because that is more specific for you, for all of you as professionals in Nigeria to create a more peer-to-peer environment. So all this will happen next week. So until then, again, Ogbuche, thank you so much. And we will see you again when we begin CLC2. But in the meantime, thank you so much. Thanks, everyone. I wish you a great weekend and then please complete your courses as soon as possible. Thank you so much, Shreya, for facilitating this session as well.
Thank you,
Bye,
Sanjay. Thank you.
everyone.
Bye-bye.
Bye.
Thank you. Bye.
Bye. Have a nice.
Bye. Thank you.